Live from clickorlando.com, this is News 6. This is a News 6 Plus takeover. Here now is Solutionaries.
Welcome to Solutionaries. I'm Lewis Bolden. For as long as we know, mothers have faced pressure from society to look, act, and feel certain ways. From the very start of their pregnancy, moms report being bombarded with unsolicited advice, theories, and opinions, sometimes from complete strangers. Every week on Solutionaries, we examine big issues and highlight people working to solve them. Today, we're talking about motherhood. So I'm going to tell you about my mom. My mother, Mary Bolden, was equally sweet as she was feisty. This picture was taken 10 years ago. She had Alzheimer's and passed away in April of last year. Making sure mothers, both young and old, get the best care possible benefits all of society. So let's take a look at a serious issue right now, and that's maternal mortality. A report from the CDC shows the number of American women who died while giving birth spiked dramatically during the COVID pandemic, with women of color being the most impacted.
23-year-old Selena Martin was thrilled when she found out she was pregnant, but she was also concerned about getting the kind of care she needed.
One of my biggest anxieties was if I have to go to the hospital, I may not make it.
The stakes for pregnant women like Martin are high. Mortality rates among Black women are nearly 3 times higher compared to white women, a sharp increase from previous years.
There is certain levels of fear.
Kai Lindberg is an advocate for maternal and infant health.
What do those numbers say to you?
I think that it's contributed to a lot of things. Medical coverage, even access to care, like prenatal care. Here in Georgia, as an example, there's counties that don't even have a labor and delivery unit, an OB. I mean, that's unconscionable.
One thing that could help is having a doula, someone who guides women through the complexities of pregnancy, birth, and postpartum. Martin, a doula herself, has one for her own delivery next month.
I think the biggest thing that a doula can do for you is empower you. It's like calling your best friend. That's what we need. We need to know that we're being uplifted and taken seriously.
The need for prenatal care for or underinsured mothers is so great in Florida. That's why one woman decided to take a different approach to bringing care to moms who need it.
Welcome to the bus. This is our waiting area. When somebody first walks in the door, this is where they sit. On the exam table, people will get a prenatal checkup. This is where we're listening to heart tones on little babies and measuring bellies and drawing any labs that they might need.
A one-stop shop for expectant mothers to get the prenatal and postpartum care they need.
This hooks up to our ultrasound machine so that moms can see their little babies when they come in.
All of these services offered on a bus, the Midwife Bus. Owner Brooke Schmo is a licensed midwife who had a vision to improve access to prenatal care for those who are uninsured or underinsured.
Just breaking down barriers, whereas there's nobody who's doing that for these people. And so it's not good as a community.
Leaving the maternity clinic she worked at to take her midwifery on the road, getting a hold of this bus, then applying for a grant through Orlando Health to get the wheels rolling.
One of the really appealing things with Brooke's idea when she first approached Orlando Health was that she wanted to be able to take prenatal care and care while women were pregnant actually to the patient versus waiting to have the patient come to clinics or hospitals to receive services. We knew that was a need in Osceola County because of their geography and the difficulty many patients have getting to bricks and mortar.
With a grant from Orlando Health and donations, Schmo converted this 40-foot bus into a mobile maternity clinic. The Midwife Bus has been serving families in Osceola County since 2020. Now she's expanding services to Orange County, here in the Holden Heights neighborhood. The location's identified through a community needs assessment. She's got an ultrasound tech, certified nurse midwife, and consulting OBs as part of her staff. For patients who are uninsured, the Midwife Bus charges based on income.
I really appreciate everything that you do. Yeah.
Maxime Carmen was halfway through her pregnancy before she met Schmo, saying other maternity clinics wouldn't accept her insurance.
It was very discouraging not having a midwife to let me check the baby and to see if the baby's okay was really hard for me. She definitely goes above and beyond. I think she's for me a hero.
Maternal mental health is a big topic these days. According to the National Institutes of Health, around 1 in 7 women can experience things like depression and anxiety after giving birth. In one town, mothers and community members are joining forces to supply much-needed support to moms, from physical items to words of encouragement.
Hey, yeah, there you go. There you go, you smiling. During my postpartum depression, I felt like alone, and there was so many things that I was going through, and I'm just like, how am I gonna get this done? My name is Nzinga Bastion, and I have 2 kids. I have 2 boys, Caleb and Khalif. Yeah, for sure. The biggest one is my random crying. I cried a lot for, I don't know, some of the weirdest things, I'm like, why am I not washing my dishes? I just started crying. I'm like, I can't get it done.
You know, recent data shows that 1 in 8 women suffer from postpartum depression, and over 50% of those had some type of depression or mental illness during their pregnancy.
Their grandma is a big help. She's been there for me since I was 7 or 8 months pregnant. She's been a help. She's been a lot of help.
The grandma on the dad's side?
Yes.
Mm-hmm. Is the dad in the picture?
Not currently,
Yeah.
because he's incarcerated. So.
Okay. Yeah. So, so that's a different situation too, because even if it was somebody who could pay child support or something, that eliminates that.
Yeah, that it does. It takes away, and I feel like if he was out, because when he was out, he was a big help with Caleb. He was there. He was active. So when he was taken away, it was part of the depression stage, part of trying to figure out how to do this by myself now, because I was so used to having a partner there. That was tough. I was in the hospital actually giving birth by myself. So that was new.
We all need help at some point in time. None of us are exempt from that. And so this is what we want to continue to give to the community, is that hope and inspire them to do for themselves, and whatever that looks like, and being okay with asking for help, because asking for help makes you feel so uncomfortable. And we want to make sure that we're creating a space where you feel like, oh no, I can actually ask for help. Let them know what it is I need. I am Kay Matthews, Executive Director and founder of the Shades of Blue Project. Shades of Blue Project is an organization that is primarily focusing on maternal mental health in underserved communities of color.
Yes. Lots of boxes, lots of brand new things.
Yes, dignity is a big part of this for us, Haley. We don't want to, there's nothing wrong with use, don't get me wrong, but there's something that gives you a different feeling when something is new. It renews you, and that you don't, feel like I'm asking for help or I'm begging for help, and this is just what somebody decided to give me. We have everything from toys all the way down to dishwashing soap, because the basic necessities are sometimes the hardest things to come by. Even sheets, pots, pans, microwaves, we have all of those things available that hey, if you check it off on the list, if that's what you need, then that's what we're giving you if we have it.
Sometimes there is help, but people make you have to jump through hoops to get it.
A size 6?
Yes, ma'am.
All right.
It's not like that here. It's so easy. Like Kay says, all you have to do is ask. All you have to do is ask. That was relief, actually, because just not having to worry about how I'm going to change a diaper, it was refreshing. I remember when I was pregnant with Caleb, I got a gift card, which I used to actually buy his stroller and his car seat and his crib. So that really was helpful, because at the time I was trying to figure out how I was going to pay rent. So I was like, I'm about to get a baby. How am I going to figure this all out?
I actually come into this space because I delivered my daughter stillborn. But my interaction with people during and after that time was just one that I kept telling myself, this can't be. I never heard my friends talk about being treated like this or ask weird questions by the hospital staff.
Because you weren't taking a baby home, you felt like they did not treat you like a postpartum mother.
Mm-hmm. Yes. That's it. And I wanted it to be different. When I started to really focus on others' mental health and have these conversations, then everybody had a story. And I was like, oh. So I wasn't by myself, although that's what I felt. I also felt that way, but I also knew that that couldn't be true. I was like, I can't be the one person in the world that is experiencing this. But if we're not talking about it, then that's where the lag comes in. So I started talking about it and being very loud and verbal about talking about it. Then others felt comfortable about talking about it. And then I just merged the two together because I understood that even though I may need to talk about what's happening to me mentally, I'm still gonna be concerned about these diapers. I'm still gonna be concerned about these clothes and whatever else is happening in my household. So we wanna really hone in on this space at least for the next 5 years. But growing out our national spectrum, we're incorporating an ambassador project that will be able to take elements of the Shades of Blue project and be able to utilize them. So we're sharing our model within communities and building community partnerships.
It's gonna be stressful, it's gonna be hard, but just one day at a time, just keep faith, just know you're not alone, and just reach out for help.
We'll be back with Solutions for Moms in just a moment. I'm Louis Bold, and welcome back to Solutionaries. Today's show is about motherhood, the ups, the downs, and the people working to make their lives better. Caring for children is expensive and stressful, forcing some families to make the painful choice of placing their child in foster care. Now a local nonprofit is offering a solution with the goal of keeping families together.
They were weekly at one point, and then it went.
Little Lincoln is growing up happy and healthy and together.
This is Lincoln.
This is Lincoln.
Lincoln
Can you say
Elias
hello?
Conklin.
With his mom and dad, Terry and Vadrana Conklin.
What were you most worried about?
His future, Lincoln's future. Can I keep a healthy pregnancy? Will I have the care that I need?
Vadrana lost her job right after COVID started, and she was worried she might lose Lincoln to foster care.
It's tough. You fall pregnant and you're like, I have to make a decision, you know? And especially nowadays, like, what decision do you make? Like, do you keep this child? Do you do this? How do you keep your family together? How do you keep everything together?
Hey, how you doing?
So they get a visit every month from the Children's Home Society of Florida.
Let them know that you're proud of their efforts and tell them what they've learned.
A home visitor.
Along the way, if he creates a new skill, support that too while you're at it.
Who listens and learns what the Conklins need and then fills that need.
What are you actually doing for these families that help them stay together?
So we're working on those protective factors. We want them to have a support system within their life, whether that's family or friends or a church that can wrap around them.
The Children's Home Society's Kenna Glover runs the Healthy Families program for Seminole County. 100% of their families have been able to stay together and stay out of foster care.
We have definitely seen families within our program that have had some issues with some mental health or different things that, you know, they've really struggled with, and they may have ended up in the welfare system that we've been able to kind of help put protective factors in place, some support systems or some programming in place, a referral to help them, you know, be able to stay together.
CHS reaches out to most families after their first OB appointment when they are screened for any needs or risk factors like mental health or substance abuse or lack of employment.
Allow them a chance to figure out the new skill on their own.
And then they build a relationship of trust and support with one goal: to keep families together.
The Children's Home Society of Florida had a 100% success rate last year. But for some families, foster care is the only option. That's where a program called Care Portal comes in.
I know who's gonna win.
Your turn.
Uno. Uno. I knew it.
Smarty.
I knew it.
Okay, you won the second hand. It's been hard at times because it was just me and my husband for years. We went a lot of years, just the two of us, and all of a sudden to have 3 children, it's been a big adjustment. But now I can't imagine life without them living here.
Did you say Uno? Yeah. Did you? No.
I had to get my grandchildren because it wasn't a safe environment they were living in. So I filed for custody, and got it. I had nothing when I got them. The parents wouldn't let me take clothes or anything. So social services hooked me up to the Care Portal.
Talk to me about what is Care Portal.
Care Portal is a technology platform that connects churches to families that are struggling. A lot of times there's a church, on the street, and maybe 4 doors down, there's a family that's in need, and the two don't know about each other. So Care Portal connects those things to try to bring support to families so that they don't have to have their children go into foster care.
And what kinds of requests are made through Care Portal?
Just about everything. It starts with diapers, bus passes. We've had one request, people needed a well. They had been without water for a year. We helped with that. So, it just runs the whole gamut. Beds are probably the most common thing.
The day we were there, the family got a new washer.
Sometimes it feels like life or death, because sometimes if it wasn't for them, the light bill wouldn't get paid. Or, I do get some food stamps, but not enough to feed 3 active kids. So sometimes that runs out, and then I have to take part of my paycheck to buy groceries, and that takes it away from my bill.
Why did Care Portal come about?
Because of the need. There's a foster care crisis in America. And there's a foster care crisis in Virginia, and there's a foster care crisis in our community. For example, Virginia has ranked 48th, 49th, and 50th for getting kids into families before they age out of foster care.
Since Care Portal launched in Central Virginia in 2020, they've served more than 3,000 children with an economic impact of $1.3 million.
The results of this program, we're seeing the economic impact, we're seeing the numbers of families served, but it goes beyond that. It's keeping families together.
It's absolutely about keeping families together. We want to serve at various stages of families' lives. For example, we want to support families upriver before the children go into foster care. We want to make sure that they're supported and the children never have to go in. Then, if sometime when they do go into foster care, we want to be there to support the foster family. Foster families, 50% of them quit after the first year.
Our church is very active in Care Portal. We help with rent checks, we deliver furniture, we support families in a variety of different ways. As the church, as Christians, we are called to give to the needy and to love each other as we love ourselves.
So walk me through the process. How do you get involved as a church?
It's very simple. You need a small team of people that are going to support you and help you meet the requests that come in. You do not have to be a member of the church to be on a local response team. A lot of them are just people that have the same heart and passion for the community and want to serve and may go to a different church.
What is it like looking at some of these requests for just like the most basic things?
So the neat thing is that the caseworkers are going into the homes and they are meeting the families and they are really assessing what is an actual need and what's not. And so you feel like you have somebody vetting it for you. So you just trust them and trust that they know what that family needs.
In the foster and adoption world, there's an idea that not everyone is called to foster and adopt, but everyone can do something. And Care Portal is that something.
Are there any limitations to what you can do as a church or as an individual?
So we would love to have more churches involved. We would love to see Care Portal grow. And if it could grow, then we won't have to have requests sitting out there and not being met.
They help with clothing for the kids. School started. They've done Christmas, took up money and bought the girls Christmas gifts.
They have helped us with clothing, bills, so many things, and I really want to do something for them when I'm older, like figure out who helped us and try to give something back to them, try to help them out a little bit.
Helped us a lot. It's just made life a whole lot easier for me.
Nanny is absolutely amazing. I would do anything for her in the entire wide world. I really love her so much, and yes, she has gone through a lot. We all help each other in this house, no matter what. Family is always family.
On Solutionaries, we're always looking for solutions to life's toughest problems. You can explore all the topics covered on this show right now on the new 6 Plus app for your smart TV. Like this episode about how we can protect kids from online predators, or this one about the creative solution to cleaning up Florida's beaches. It is all on News 6 Plus. I'm Louis Bolden. Thanks for watching.